Hello friends, this is Dr. Samrat. In Dr. GPT, first this is a video I am specifically creating the consent by using AI. Friends, we know there are consent which is mandatory in court of law. Our today's topic is how to create a patient tailored procedure specific surgical consent by using ChatGPT, the AI which I mostly use. So the present days what we use is a general consent, and our administration hospital request us to create a procedure specific consent. When we use a simple general consent, the general consent is typically it states patient to allows doctor to examine, investigate, treat them as required. This we take in every hospital. There will be a standard format. I give consent to receive medical surgical treatment as advised by my doctor. These are administrative requirement, but these are not medico-legally strong consent for any kind of surgery or procedure. So what medico-legally we required is procedure specific consent. This consent for particular procedure. Suppose I am doing lap cholecystectomy, fistulectomy, hernia surgery, bypass surgery. The procedure name, basic step, general risk we put, common complication we add up. The limitation of this, all patient undergoing particular surgery, same risk profile. It's not like that. We assume like that. We do not account for different comorbidity, previous surgeries, anatomical variation. Hence, these are partially valid consent, but these are not foolproof for if any complication arise in the hospital. I give consent for laparoscopic cholecystectomy. I understand the risk, bleeding, infection, better than general consent, but still limited medico-legal use. But definitely at least we need to take this kind of consent. But this era where AI is there, patient knows all this thing, what kind of complication happen. So as a doctor, I think we need to upgrade ourselves. What I am suggesting is we need to go for patient tailored procedure specific consent. These are the modern medico legal concept. This consent should be customized. This combine both procedure and individual patient risk factor. For example, patient diagnose, indication for surgery, exact procedure, unique risk, possible alternative option, expected outcome, specific risk of anesthesia, blood transfusion. For example, a person A might be undergoing lap cholecystectomy and person B is also undergoing lap cholecystectomy. A might be a 40-year no comorbidity, the risk is different, and 65-year prior cardiac stenting undergoing surgery, the risk is definitely going to be different. So we need to devise our consent for particular patient tailored procedure specific. If I tell these are the best which we can use in medico legal, I think any medico legal expert can tell ethically these are sound and build the trust and transparency, because when they are signing they will read everything, so it create the trust. So these are the best and legally strong. General consent, these are the blanket permission in any treatment, legally medico legally weak, and personalization is less. These are administrative form, compulsion form, but not valid in medico legal law route. Procedure specific, these are mentioned planned surgery, common risk, these are moderate legal strength, and personalization is minimal. Consent for lap cholecystectomy, but the patient tailored procedure specific consent, these are customized to patient comorbidity condition, these are medico legally strong, personalization, and it create the trust for the patient when they read through the consent and the elaborate material we write. And nowadays patient also ask the AI like ChatGPT, Gemini, and Grok. They ask, I am going Whipple surgery, what can be the complication? They know. And in fact, I think nowadays we should tell them, go and check, these are the complication and we are going ahead. They will get convinced. These are the things. What we need is we need to create the prompt which we can put into the AI to get the proper consent. So I am trying to do the live demonstration. So we can create the prompt and I put in the word format, but I have created the prompt for everyone. Act as a medico legal expert, and surgical consent writer draft a comprehensive preoperative surgical consent form with following input: patient name, age, sex, diagnosis, hospital ID, procedure, planned procedure, and associated comorbidity, specific consent. If suppose there will be some disease related concern, some prior surgery, laparoscopic cholecystectomy in routine patient and laparoscopic cholecystectomy in prior open surgery, the risk of adhesiolysis will be different. Bleeding risk, the patient, normal patient and prior antiplatelet patient, risk of bleeding is different. Immunosuppressive drug patient is having, anticoagulation having, risk will be definitely different. What I want, just take this prompt and fill up your patient name, age, sex, diagnosis, hospital ID and planned procedure name. If you want to give the detailed procedure name also is acceptable. If you want to Whipple, robotic Whipple is okay. If you want particularly to elaborate, I want to go for pancreatic jejunostomy, pancreatic gastrostomy, you can mention. Diagnosis, in particularly Whipple, there is a periampullary carcinoma. I have diagnosis in my hand, but in some patient there will be a suspected periampullary carcinoma, may not be having biopsy proven. You can write periampullary carcinoma but suspected, biopsy not proven, you can write that also. The planned procedure name, we are here telling to create a robotic Whipple. We have done open Whipple procedure. I am writing for robotic Whipple procedure. And associated comorbidity, particularly recently what we have operated patient, he had diabetic, hypertension, coronary artery disease, double antiplatelet. In this patient, robotic Whipple, because of small pancreatic duct, we wanted to do pancreatic gastrostomy. How much you are more precise giving your prompt, that much it will give output more precise. I am writing here, I want to do the pancreatico-gastric anastomosis in view of small pancreatic duct. So we can elaborate more and more detail so that it will create more better consent. And what associated comorbidity, our patient has diabetic, hypertension, coronary artery disease, he was on dual antiplatelet, all those things we can mention in detail. And also our patient has left renal artery stenting because of renal artery stenosis. So all the detail we can write. How much we put more about the details of planned procedure, associated comorbidity, what is our special concern, kind of this patient, the risk of stent block if we stop the antiplatelet post-operative, or if we continue the antiplatelet, risk of bleeding will be higher, and patient may need cardiac intervention. Those are the special risk. If suppose I am operating on the hernia, the mesh infection can be a risk. Or special concern what we can mention is clinically, USG radiology wise, we are having the right sided hernia and there is a cuff impulse on the left side, we may need to do the procedure on table on the left side also, that we can mention. Suppose we are having fistula patient, abscess patient on table, if we find out internal opening, I will do the fistulotomy for the patient, we can mention. Or we can mention the special risk that this patient is having on table, we are planning for colonoscopy. If suppose Crohn's turns out, I will put ceton and come out. So special concern, just elaborate what is your concern in this patient, so that patient also will understand in medico-legal language and they give consent by signing, reading and signing. So here in this patient we are mentioning special concern as a bleeding, mentioning special concern as a risk of stent blockage, we can write those risks. And instructing to draft, use a clear, this is a prompt. Now once you fill up this much is more than enough. What we are giving, the use a clear, simple, patient friendly language, avoid the jargons and ensure the document is medico-legally strong, present present with the content neatly, and heading, subheading, all the prompt I have already created in the prompt. Those prompt by default you write basic information and just allow the prompt to copy and paste in your ChatGPT. ChatGPT will start creating the specific patient centered or patient tailored procedure specific consent we can get from this. And further going, alternative option, procedure specific risk, what is their expected benefit, general risk of complication, alternative option, consequence of if not getting this surgery, that is also important, possibility of additional procedure, because if suppose we are going for Whipple surgery, feeding genostomy is additional procedure that we can mention that if required intraoperatively, the bar feeding genostomy. And post-operative course, how will be the post-operative stay, recovery, rehabilitation, follow-up requirement, use of blood product, implant if it is a hernia, suppose knee surgery we are doing, where implant we are using, any medical device we are using, consent for photography and recording, some cases we need to record it, and some cases workshop we are using this, statement of understanding, information was explained in their language, they had opportunity to ask question, all doubt has been clarified to their satisfaction, and declaration by the patient, patient relative, witness, surgeon, and anesthetist. We can even add assistant surgeon because it is a major surgery. We can even add the name surgeon XYZ, assistant surgeon ABC, anesthetist DBE, all the thing we can add, and ensure consent in professional, patient friendly, medico-legal, robust, and suitable for direct print, and use a hospital setting, useful in hospital setting. Give me output, then it will give you the output. I want output also to be defined. Give me output ready to print in Word file, that is docs file I want. So once this fill in the blanks, you need a patient specific information and surgeon, assistant surgeon, anesthetist information, or somewhere if you want to add 1 or 2 line plus or minus, you can add. Particularly here complication I have requested as per the guideline, and copy paste in your ChatGPT, and once pasted just run it, and then it will run. Just copy that whatever you have done correction and put it in next few minutes, it will give, and click it, you will get the Word file. Once you get that Word file, open the Word file. Let's see how consent has been created by ChatGPT and is it suitable. Now you can see that patient name, age, hospital ID, periampillary carcinoma, planned procedure. What is planned procedure? We are doing robotic Whipple, particularly pancreatic gastric anastomosis union of small pancreatic duct. Simple word, this is a major surgery performed to remove the cancer located near the pancreas, bile duct, small intestine using robotic assistance, better for the better precision. Pancreas is connected to the stomach instead of the intestine because of small pancreatic duct, which is explaining procedure very perfectly. Indication of surgery. Surgery is indicated to remove the tumor causing blockage and jaundice, and expected benefit, removal of the cancer, jaundice clearance, improvement of the digestion after the recovery, and potential improvement of the survival and quality. It is not clearing the disease, it is potentially improving the survival. General risk, all the risk in percentage, because I told it make it the percentage of the complication as per the guideline. Procedure specific, like pancreatic leak 10 to 20%, bile leak 5 to 10%, bleeding 2 to 5%, delayed gastric emptying 10 to 15%, wound related infection 5 to 10%, leakage of pancreatic gastric anastomosis 8 to 12%, and risk of heart related complication, that is very important because antiplatelet we are going to work on the antiplatelet 5 to 10%, risk of dysfunction of left renal stenting, because risk of renal artery stent also blockage, reoperation and prolonged ICU stay 5 to 10%. Alternative operation, non-surgical, there may be tumor can be temporarily, we can do the bypass procedure. Consequence of refusing, that also has been mentioned. Possible additional procedure, we are taking a consent. In this patient, we can ask the consent for the feeding genostomy. And post-operative outcome, ICU stay may be 2 to 3 days. Total hospital stay, this need to be corrected. Robotic, it can be 5 to 7 days. As per the guideline, it has written 10 to 14 days. We need to manually correct it. And again, recovery, gradual diet, and possibility of blood transfusion, prolonged ICU stay, follow-up and discharge, of the wound, nutrition, oncological outcome, everything. Consent for photography recording we can take. A statement of understanding from the patient we can get from this consent, and also the signs we can just a little bit here and there make a correction. Every consent created by GPT not going to be right. In every patient we need to modify the consent as per, but the standard format is very good. In 2 to 3 minutes adding this prompt with basic information, you will get a superb consent. So this patient I want same consent to create a consent in Hindi. We can convert this consent in Hindi in just 1 or 2 minutes. We can just convert this consent into a Hindi consent in 2 minutes. We can create it in Marathi in just 1 or 2 minutes. We can see this converted into a Hindi, and even we can ask bilingual consent. Just open it. This is going to be a Hindi consent. We just need to use some our common sense to recorrect it, but we will get structured format. It's never going to be 100% correct, but we'll get a structured format. So I'm just again trying to use this consent for different purpose. So for this patient I am just trying to use this consent for creating something for doing for hernia, so right sided inguinal hernia. So same prompt, few of the thing, just change it, name of the patient and procedure what you want, and what specific thing you want to ask the permission from the patient. A specific, if it is an implant, you have to bit on elaborate about the implant. Whatever you feel, you can just modify a little bit and just paste this prompt. You will get a good consent format, and once you get that output, that output just see what things you need to correct, and after that give a written thing to the patient, and also just take a few seconds in patient language also make the consent and give to the patient, and get the sign of the patient on hospital paper, so that it will become documented. You get the general consent that in OPD while admission any hospital takes it. You get the procedure specific consent because this is hospital routine, let it get. But when you are doing surgery, if you want to be foolproof medico-legally in future, your consent is one of the valid document that should not be forgotten. And ask ChatGPT, use this prompt. I will give this prompt in link, and just fill up the few of the thing and just put in the ChatGPT. You will get a very good format of consent, and once you get that output, just use a common sense what you want to correct in that consent, and give this paper to the patient to sign it. Once they read, they will get a trust. What the patient does is, this is amazing. Recently I given this patient had taken a photo all 3 pages and put on the ChatGPT. The ChatGPT told these are all absolutely correct because these are the possible risk. So patient will get confidence, and you can ask the patient, put on the Google, put on the ChatGPT, get your opinion from any other person. So the patient will get the confidence, and you are also medico-legally strong. Hospital is also at the safer zone. I think in this era of 2025 where AI is dominating, we should use the AI to create a best medico-legally strong consent which can help us in future. Now I will give the task. The consent is there. I think everyone can have access for ChatGPT. Being a surgeon, if it is feasible, just get the paid version. If it is not feasible, use a free version. It has some limitation, and use this prompt, and whatever tomorrow you as a surgeon you are going to do the surgery, just put few of the basic detail and get your consent, and just correct that consent. Send me the what you have done and how do you feel. Put in the comment box what is your opinion about this patient-centric procedure-based consent, and if it is helpful for you to understand about the consent, share and like this video, and subscribe our channel Dr. Samrat Jankar. And we are planning to create more and more AI based video which are useful in our clinical practice. So this is going to be a Dr. GPT video. Let's learn the GPT for a surgeon to make a life better and more comprehensive life and more medico-legally strong. Documentation are important, and many of the area where ChatGPT can be used, one by one we can explore. And also comment in the box as a doctor where you are using ChatGPT for your clinical purpose. Thank you for watching this video. Thank you. Thanks for